Hello everyone and welcome back to Clinical Cousins YouTube channel. You already know why you're here. You want to learn about hemoglobin. You want to become a hemoglobin master. So this is what I'm going to give you today. I'm going to make you a hemoglobin master by the end of this video so that all of a sudden you have a few aha moments. Everything starts to make sense. Okay, so we need to talk about oxygen. What is oxygen? Why is it important? Well, we know that it's important for our cells. They need it to use energy that we consume, and they also just needed to function normally. So the funny thing is, something that was kind of counterintuitive to me at least, is that oxygen arrives in different forms and it's not what you expect. Okay, so only 2% of the oxygen is actually dissolved in our blood as a gas. And remember, from our previous videos, we talked about dissolved gas is what creates partial pressure. It's what drives that diffusion. Okay, so 98%, so this is the vast majority, 98% of oxygen is actually bound, and it's bound to a substance called hemoglobin. Okay, so if somebody has drastically reduced hemoglobin, is this 2% going to be enough to sustain their bodily functions? No, that's why anemia can be so serious. Okay, so how is oxygen attached in the first place? Why is oxygen attracted to hemoglobin? Well, oxygen is attracted, I want you to think of ferrous iron is sexy iron. Okay, so oxygen is attached to us. Ferrous iron. Ferrous 2 plus. Okay, so we're going to talk about some grown-up things now that we have that established. And I'm talking about adult hemoglobin, hemoglobin A for adult. Okay, so this hemoglobin is what you and I have if you're watching this over the age of 1, which I assume that you are. In each hemoglobin, there's actually 2 alpha and 2 beta chains. Okay, so each adult hemoglobin, what I've drawn here, it has 4 iron pieces. Remember, this is that us iron, that sexy iron us 2 plus, right? So each hemoglobin molecule can actually bind to 4 oxygen molecules, 8 oxygen atoms. So what happens, or I'm gonna ask you a question, what happens if you have that icky iron, if you have that iron 3 plus, and then you decide to go and hook up with your siblings and cousins for a few generations? Well, you might end up like the blue fugates of Kentucky. So I'm talking about those famous blue people that you might have seen in the Guinness Book of World Records. They're sometimes called the Smurf people, but this family has a genetic condition that causes them to produce hemoglobin with iron in the ferric form. Remember, incest is icky, so ferric iron. So we're talking about iron 3 plus. It's abnormal, it doesn't work. So methemoglobinemia is the name of this condition, hemoglobinemia. So this is hemoglobin with iron in its ferric form. Okay, so this cannot bind oxygen properly because of abnormal hemoglobin reductase. That part is not important, but it will actually turn you blue if you have high enough amounts in your blood. So this condition, it can also be caused in regular people, regular patients, by certain nitrate drugs, certain sulfonamide drugs, and strangely enough, the treatment for methemoglobinemia, the disease that turns you blue, is a substance called methylene blue. Okay, so we need to talk about a parasite that is likely living in some of you right now. I'm talking about babies. I'm talking about fetal hemoglobin. Hemoglobin F, F for fetal. Okay, so fetal hemoglobin, and we're talking, it's different than adult hemoglobin because it has to be, right? This fetus is wanting to survive, it is desperate to survive. So it actually has 2 alpha chains, just like in adult hemoglobin, but instead of those beta chains, they have these sticky gamma chains, and this is what actually gives hemoglobin, this fetal hemoglobin, its magical properties. So this hemoglobin, this fetal hemoglobin, actually has higher affinity, meaning that fetal hemoglobin, it lusts for oxygen, it craves oxygen desperately. So the fetus will actually, it sits in the mother's uterus, right? It's sitting in its sac. It's actually able to suck that oxygen from the mother so that the fetus will actually have enough oxygen to grow and survive. Remember, the fetus is sort of like a parasite in this sense. It will actually take oxygen and hold on to it better from the mother's circulation so that it can survive. Okay, so once this baby is actually born, and up to a year after birth, it is going to start losing this sucky hemoglobin. It's actually going to start developing adult hemoglobin. So I already know what some of you guys are going to say, Christian, there hasn't been enough farm tool related hemoglobins that we've talked about in this video. But hold on, I'm about to talk about that right now. I'm going to appease all of you. I'm talking about sickle cell hemoglobin. So hemoglobin S for sickle cell. So this type of hemoglobin, it has 2 alpha, 2 beta chains, but they're abnormal in their shape. So we put a little A above them to show them that they're abnormal, and we don't like things that are different and mess us up like this. So why would somebody even develop this in the first place? Well, it actually gives them some resistance against malaria. Remember, these are in your people from African descent, some of your Asian descent, Middle Eastern descent. So this sickle cell hemoglobin is not ideal at all. It sucks. It lowers the total amount of oxygen that the person can transport throughout their body. Remember, is this enough? No, it is not enough. That's why we need functional hemoglobin. Okay, so these sickle cells, I've drawn a capillary here. These sickle cells can actually become very small and twisted, and they can actually stick together and block small capillaries. So these are like little occlusions everywhere throughout the body. So when this happens on a large scale throughout the entire body, we call this a sickle cell crisis. And the priority intervention is fluid and heat to promote vasodilation. So what are you going to do first? Somebody has a sickle cell crisis. Well, you want to expand this to make it bigger. So you're going to give them fluids first, followed by oxygen, heat, and you're going to rest. You're going to decrease the need to have oxygen. So what are the 4 most popular types of hemoglobin? We have adult hemoglobin, which is what you and I have. So we have the abnormal one. They have the ferric methemoglobinemia. Okay, so the incestual disappointment of the family that turns you blue. It's actually treated with methylene blue. Next we have fetal hemoglobin. So this is used by the parasites, right, that occupy the uterus for about 9 months. And lastly, we have sickle cell hemoglobin, the ineffective, sticky together hemoglobin that needs fluid and heat to work properly. As always, thank you so much for taking the time to learn with us today. Remember to like and subscribe for more content. Thank you.